Welcome to the show. We have Debbie Hecht from the Virginia Maurer Foundation, which was founded in 1975, and it's a 501c3.
It is a 501c3, yes.
How are you affiliated with the foundation?
I am the executive director of the foundation, and the foundation was actually started by Dr. Virginia Maurer.
Right.
She's the inspiration behind it, and she's actually a breast surgeon on Long Island. She has two offices, one in Comac and one in Mineola.
What's located in Hauppauge?
Hauppauge is our offices, the foundation's offices on Commerce Drive in Hauppauge.
What's the mission statement for the breast?
Well, basically, I just want to talk to you a little bit about why she started this foundation. Dr. Maurer in her practice recognized that a lot of people, a lot of women were misinformed about breast cancer and realized that misinformation or lack of knowledge can have fatal consequences.
Absolutely.
So she really felt that that she needed to educate her patients, and she started educating her patients and their families, and it took off. And she decided she wanted to educate the public to go further on it. So she formalized it into a foundation. And our mission is to save lives through breast health education.
So it's education.
It is focused on education, but knowledge is power, as you said earlier.
Absolutely.
And we really focus on breast cancer prevention.
Mm-hmm.
And early detection.
In fact, we're going to see a clip right now with Dr. Virginia. We're going to focus right now on what she's talking about, risks, myths, and early detection. Just a couple minutes. Let's take a look at this, and then we can develop that. Okay? Dr. Virginia Maurer.
I think October serves as that red flag month to say, hey, are you doing what you need to be doing 12 months a year, not just the month of October? As mentioned in the introduction, we're talking about the components of early detection. We discussed breast self-examinations, clinical breast examinations, and breast imaging, which can incorporate mammograms, sonograms, and breast MRIs. We are very fortunate on Long Island to have wonderful breast imaging in various powerful groups that help women get the right information early. As to when a woman does one of these three components is dictated by age and family history. And although family history is important, we must remember that only 10 to 15% of breast cancers are related to hereditary at this time. But as mentioned also in the introduction, there is so much research going on that I am sure we're going to find additional mutations in genes which are responsible for breast cancers and other cancers. All three components, the clinical breast exam, breast self-exams, and breast imaging, are dictated also, as I mentioned, by age. The earlier breast cancer is detected, obviously, the more options a woman has for her management, the better chance she has for survival, and potentially for cure. So the three myths that patients were what I call the three myths, which I kept hearing over and over and over again, is my mammogram is normal. This thickening or lump can't possibly be anything. Well, that's wrong. Breast imagers will tell you all the parts of breast imaging cannot reach 100%. You still have to take in the clinical breast examination, and there's often necessary to do a needle biopsy of something you feel, even when the mammogram, particularly in a woman whose breasts are dense, does not demonstrate the abnormality. Another myth that I've heard is, gee, I have no family history. There's no way I'm ever going to get breast cancer. Well, I mentioned earlier, that too is not correct. But also, when you're discussing family history, it's amazing how many women did not appreciate until the last couple of years how important family history is. And not just is there breast and ovarian cancer in your family, there are other syndromes that look for others, like thyroid cancer. So there are multiple cancer syndromes. So history, family history is very, very important, and not just for the breast cancer component. And the last myth, which to me is really quite important, is I'm too young. I can't possibly have breast cancer. Yes, it's uncommon to get breast cancer in the 20s and 30s, but I've been practicing for 30 to 35 years now, and I think every lump, every change in a woman's breast should be pursued until you can actually say this is nothing. we're never too young because age is no longer a protection for many things. So I would just strongly encourage everyone, despite your age, to pursue sonograms or whatever is age appropriate, and then go on to the other breast imaging studies under the auspices of your breast imager or physicians.
So we're looking at some of the risk factors that are involved, as Dr. Maurer just said. I had breast cancer, nobody in my family. I was 25 years old, I didn't drink, I didn't smoke. There are some risk factors that we are not responsible for, things that we can't control, such as your first menstrual cycle, your pregnancy, if you ever got pregnant, your family history, your area around you. But there are, of course, some risk factors that you can. I know that obesity, exercise. I know Dr. Maurer said that a good half hour a day would be excellent. And we're talking about nutrition. So tell me a little bit in the field of nutrition.
Well, first of all, we know that a large percentage of the breast cancer cases are estrogen related. So for the things that we can control, what we want to do is lower our estrogen levels.
Right.
In the case of nutrition, we're talking about reducing your fat intake. Trans fats. We actually have a little switch list that we give to attendees of our seminars. The kids, we take the program to high schools and college campuses, and we give them a little switch list. So instead of having a burger with fries, maybe you can have grilled chicken. So it cuts down on your fat.
And I think people would be surprised to find even the amount that you give. For example, butter is the tip of your thumb. That should be the amount that you're supposed to be using.
Right.
And so what I do, just jumping into this butter. Now you bring this to high schools, and you have Being Breast Smart, in which you have people trained to go over this. But you also have a 40-minute program. Risk factors are but one. You have...
Well, what we do is we have a 40, 45-minute seminar. We work with the health teachers and bringing the program into high schools and colleges. And we basically go through risk reduction strategies, the things that you can control. Prevention is really key. The incidence of breast cancer on Long Island is very high, so it's very important that we do take matters into our own hands. So we get into all the risk reduction strategies. It's alcohol, as you said. It's
not
smoking.
Even one drink a day. Does Dr. Virginia
It can contribute to the risk.
Right.
Smoking.
One drink.
Certainly nutrition, exercise. There are certain things about the environment that we should be conscious of. The kids who are on the soccer fields and they throw their bags on the grass, and then they bring it into their house and they put it on their bed or their carpet. And pesticides can live in carpet for 5 years. So we have to be careful. And the more you know, the more you can protect your health.
Protect yourself.
And we introduce this to young people as young as high school juniors and seniors.
I'm sorry, you do a breast exam on a silicone. Now we have guys and girls.
We have a breast model
Let's
here.
Let's take a look at that.
We focus on early detection. We want to either stop breast cancer before it starts, or we want to find it early enough when it's most treatable. We have educators who go into program and they teach breast self-examination using these silicone breast models. And in the model are different size lumps, and there are different depths, and they teach the Maurer method for breast self-examination. So they actually, and you actually have to go down for different depths to really be able to find these lumps.
Why are you not supposed to do this in a shower? For example, I found my lump when I was in a bathtub with soap, and now I'm told no, that is not okay.
Well, I mean, we want people to do this no matter where they are, but in a shower you might miss something. I mean, because of the water and everything, there is a possibility that you can miss something.
And 80% are not cancerous.
80% of the lumps are not cancerous. But if you find something, that the key is just to call your doctor and have them check it out. That's what's important.
One more quick question. Because I had breast cancer, I have implants. Is that different? Is that going to be my examination? Should it be any different if someone has implants? Just told the world.
I have to tell you, my educator would be best to answer that, not me. So I couldn't really answer.
Okay, but that's something that
it's a very, very good question.
Has to
and
look into.
If someone has that question, they can go to our website. They can call our offices, which is 631-524-5151. and we will be sure to give you the answer on that kind of question.
Okay. The other thing too with the young people, the young adults, we said being breast smart, and that training is approximately how long? It's peers, it's children.
Right. We have a program
teachers.
called it's peer-to-peer,
Okay.
which is such a wonderful program because young people learn so much from their peers. I mean, they're influenced by their peers. They learn a lot from their peers. And honestly, the learning is that much better when you're training another child
Of course.
to teach, to go out and teach. So that training could be, it's a couple of days. It could even be up to a week. We do go into the schools and we have peer-to-peer training.
Now with colleges, you bring in alcohol, you talk about that, and you also talk about birth control. Do you want to tell me a little bit about that?
Birth control is one of those things that it may be a risk.
Okay, that's why you bring that up on the college level. Now, what about using wellness in the office, which would deter quite a few illnesses?
Well, I mean, honestly, we have a seminar that we bring in. It's a breast health corporate wellness seminar. We bring into companies. We do it as a lunch and learn during lunch, so it doesn't take off time from the workplace. It's such a smart thing for companies to bring in this program because we'll help you reduce your medical costs,
Right.
your costs associated with health insurance, with your medical costs. Lost productivity goes down.
Absolutely.
Your employees appreciate it. I mean, it shows that you care, and it's really a really smart thing to
I have
do.
to say here that size matters. And the reason I say that is because you have this big pink bus that travels across, and the purpose of that is to show that the size of the tumor definitely matters. The earlier that one can be reached, the better are your chances. When we come back from commercial, I'm going to ask you about some of the different events you're doing. You're a golf, you're a beautiful gala coming up. We'll be right back. Foundation has so many different events to raise money. You have the Flamingo Bowl, which is in March. You have, of course, your golf, the spring golf, which is in May. And now coming up on October 17th at the Carlton in Eisenhower Park, it's going to be the Pink Diamond Gala. And this is going to be an amazing event, and people can buy tickets how?
Well, they can go to www.maurerfoundation.org or call 631-524-5151. It's really our biggest fundraiser, and it helps us to put our programs out there, our breast health education programs out there to the community.
Can you believe how quickly that time went? And I thank you so much for your kindness, for what you're doing and making a difference. And I do hope that we've helped you out there as well. We're going to say goodbye and see you next week. Are you ready, everybody?